Hey everyone, I hope you're having a good Thursday. We're going to finish up our discussion this week on vaginal discharge and vaginal odor by kind of combining everything together into our summation YouTube video. So remember that we discussed kind of what is normal, what is abnormal, things to kind of, look for in each of those cases. And so I'm going to talk about that in more detail today. So just to kind of go through a brief overview, remember that the vagina, basically, for lack of a better term, is like a self-cleaning oven. It doesn't need any assistance to maintain its normal bacterial flora. The organisms that live within it are doing their job just fine. The normal concentration of a bacteria called a lactobacillus, it's probably the most common type of bacteria that's in the vagina, keeps the vagina at a relatively acidic pH, usually between 4.5 to 5 or so. Now, what that does is it keeps any type of bad bacteria or yeast really at bay because they don't like that acidic environment. Likewise, the lactobacillus being there in such large numbers kind of act as almost like a competitor for resources, if you will. So it kind of keeps those other bacteria from being able to gain any type of foothold in terms of food or shelter or resources otherwise. I don't it's not like there's a lot of resources in the vagina, but there you go. Now, the vagina itself, when you look at kind of discharge, is very much hormonally driven. As a normal menstrual cycle progresses, we'll see a change in discharge from being kind of more thicker right around, menstruation to progressing to be very, very thin and stretchy around ovulation and then kind of starting to thicken again. This is due to the effects predominantly of estradiol, which is a type of estrogen, but progesterone does play a role in that too. And actually, the term for kind of the stretchiness of that cervical mucus and that vaginal discharge is called spenbarkite. And that's something to talk about too. We talk about vaginal discharge a lot, but what we're most of the time really addressing is cervical mucus with that. The vagina, while it does secrete what's called a transidate, which is a type of discharge, especially in sexual situations, doesn't really have just a ton of just natural discharge that it's producing. Now, that's not the same for everyone. There are some women that are, produce much more vaginal discharge than others, and that's totally fine as well. When it becomes a problem, though, is really when it starts to affect your quality of life. Now, normal vaginal odor varies from person to person. It's very much dependent upon what you eat, what you're doing, your stress levels, the type of clothing that you wear, medications you may be taking, supplements you may be on. Anything in between kind of affects that. So, if you are concerned that you say, oh my gosh, I'm sitting down, I can smell myself, there must be something wrong. Well, we always are a little bit more hypersensitive to our own bodily odor. So there's a very high likelihood that no one around you is able to smell that. Now, obviously, if you're concerned, please come in, let's check that out. But for the most part, it's not as, kind of odoriferous as you think it is. That said, like I said, if you know that there are certain types of foods or things that really kind of cause that change in vaginal odor, foods like garlic, onions, ginger, very kind of aromatic type spices, curcumin, things like that. You may want to, see if you do any type of dietary change, if that kind of changes your vaginal odor, and it may, and that's totally fine. Likewise, look at, the amount of water that you're drinking, look at kind of how stressed out you are. And those can all play a role in that, as well as in the kind of type of vaginal discharge that you have. Now, color in terms of vaginal discharge, normal discharge should be between kind of clear all the way to up kind of to a yellowish tint, if you will. It shouldn't ever really be very like green, bloody, blackish, super yellow, kind of pus-like. Those are our colors that we don't like to see, that can harbor some other type of problem going on. But it's normal, especially as your cycle progresses, to see that color kind of change. And that is once again kind of due to hormones and other things along those lines. So, really kind of the normal there is so much dependent upon what's going on in your life. And if you find that it's bothersome for you, if you're like, hey, I really want to make sure that there's nothing going on, like I said, please come in and let's check you out. So in terms of abnormal, let's start off with abnormal vaginal odor. People talk about this kind of fishy odor all the time. And really, when we talk about fishy odors, what people are really referring to is what's called an amine reaction. And an amine is a organic chemical functional group, or a chemical functional group mixed with nitrogen and hydrogen ions. And basically what that is it's a reaction to kind of the certain bacteria in the vagina in reaction to basically a base, typically something like potassium hydroxide. And what that does is when those are mixed together, it releases this kind of fishy odor, and that's called a whiff test. And we sometimes will use that as a diagnostic criteria in diagnosing bacterial vaginosis. Now, people say, oh, all vaginas smell like fish or things along those lines. That may be a little bit of creative liberties with that. But if you do notice a very, very strong odor, especially if it is different for you, that is something worthwhile coming in to get checked out. But to say, it smells fishy. Okay, once again, if it's bothering you, let's evaluate it. Now, certain things definitely have a characteristic odor to them. Cervical cancer has a very characteristic odor. Obviously, retained tampons will have a very characteristic odor too. So if you smell something that is, almost smells kind of rotten, especially if it's accompanied with a lot of bleeding or a lot of pain, please come in and let's kind of evaluate you there. Otherwise, though, like I said, it's odor changes kind of throughout the time of the month and depending on what's going on. Now, abnormal vaginal discharge, if we look from a pathologic standpoint, typically is the body's response to trying to clear out some sort of infection. Bacterial vaginosis is probably the most common type of abnormal discharge that we see, and bacterial vaginosis is a condition where there's an overgrowth of abnormal bacteria, the most common one being a bacteria called Gardnerella. Now, this often occurs when the pH, or the chemical composition of the vagina, is changed and put into a more basic or less acidic kind of level. We can also see this if the lactobacilli that are normally present in the vagina are wiped out with antibiotics or something along those lines. And that allows kind of that bad bacteria to grow. Now, in order to diagnose bacterial vaginosis, there's this criteria that some people will sometimes use called Nugent's criteria. And that basically looks at things like the pH, the presence of clue cells on a wet prep, which is a type of diagnostic test we do, a positive amine or positive whiff test there, and kind of how the discharge looks. Typically, BV will present as kind of an itchy, clear, watery discharge. It may be kind of grayish in color as well, and people will often kind of attribute that to that kind of fishy or amine odor. Typically, it doesn't have a lot of clumpiness to it. We see that more with like yeast. And the vestibular tissue can be more raw and irritated with that. We typically don't see irritation kind of on the perineum with BV, although obviously anything's possible. The other thing we'll sometimes see with BV, especially in women who have chronic BV, is the development of almost this like cell membrane on the inside of the vagina. It's called a biofilm. And that biofilm basically acts like a suit of armor for that abnormal bacteria. And, you can give a course of antibiotics or give a course of treatment to try and help the BV, and it may eliminate kind of the surface of the biofilm, but doesn't really get down, beneath it. So there's a lot of different therapies you can use to help address that biofilm specifically to get rid of that in order then to allow your antibiotics to really be used. And also you can just use a much longer course of antibiotics as well in hopes of kind of breaking it down little by little by little. But that sometimes comes with its own kind of risks, just obviously with any type of long-term antibiotic use, we'd see that. Now, yeast infections, vaginal candidiasis, Candida albicans is the most common type of vaginal yeast that we see. Typically, it will present with this kind of cottage cheese-like discharge, really thick, clumpy, white stuff. But it can be more kind of a clear discharge too. Yeast, if it gets on the skin, can create kind of a red, almost shiny type appearance. So you can see it kind of in the skin folds around the labia, on the vulva, on the perineum as well. It's typically very itchy. That's another thing we see with it. Now, for some people that have chronic vaginal candidiasis, even if they take the appropriate antifungal medication, it may still not go away. And for those patients who are always going to look for either other sources of the infection, or are we actually dealing with Candida albicans, that kind of specific type of fungus that those therapies are directed for. So there are swabs we can get that look at different types of candidal fungi. Also, you may want to consider doing other types of antifungal medications that permeate tissue besides the vaginal canal. So like, for instance, diflucan or fluconazole, which is a really common one we use for vaginal candidiasis, has very, very, very poor rectal and intestinal permeability. And some women will have a rectal reservoir of that candidiasis. And then anytime they have a bowel movement, it kind of pushes yeast out. Those yeast kind of roll up the perineum into the vagina, and you kind of reseed the area again. So you want to use a antifungal that actually has a good intestinal impermeability, such as like nystatin for that. Now, other types of vaginal kind of infections that we'll see that can cause increased discharge, trichomonas is another one. Trichomonas vaginalis is a protozoa, looks like a little kind of cell with a little tail on it, a little flagella. And if you look at it on the microscope, it's like swimming all around. The flagella is just going crazy. And what that kind of typically will cause then is really copious vaginal discharge. It has lots and lots and lots of little bubbles in it. We see those bubbles because that flagella is whipping the discharge and creating air in there, almost like if you're, making a meringue or something. Sorry for the food analogy. Trichomonas is a sexually transmitted infection. So if you get it, you also want to treat it, and you also want to treat your partner if possible for that. Looking at the cervix with trichomonas, you can see sometimes what's called a strawberry cervix, which is kind of like a reddish kind of punctate changes to the outside of the cervix there. Other sexually transmitted infections like gonorrhea and chlamydia can both cause increased vaginal discharge. Chlamydia typically is kind of clear and asymptomatic. Gonorrhea, on the other hand, is that kind of thick, purulent, pus-like discharge that's just copious in nature. Now, we talked a little bit, maybe last week or the week before, about DIV, discriminating inflammatory vaginitis, as a cause of, vulvodynia. But there are some other kind of vaginal disorders that can cause increased vaginal discharge too. Cytolytic vaginitis is basically when the pH is too low and you have an overgrowth of lactobacilli, and that causes irritation and copious discharge. And then there's anaerobic vaginitis as well, which is where you have an overabundance of bacteria that are kind of aerobic, meaning they need oxygen in order to proliferate. Typically, we'll see kind of bowel bacteria with that, like anaerobus fecalis, E. coli, things along those lines. And that can cause a really copious discharge that's kind of thick, irritating as well. So it's really important, if you suffer from chronic vaginal discharge that's irritating, to go in and get evaluated to make sure you know exactly what you're dealing with, so you can get treated appropriately. So anyway, I hope that answers all your questions about what is normal, what is abnormal for vaginal discharge and vaginal odor. Obviously, if you have any questions, let me know. Take charge of your own health, and I'll check in with you again next week. Have a great day.